CBN medical reporter Lorie Johnson joins us now with more information. Lorie, I understand their new health advisory. Can you give us an update?
Pat, the White House Coronavirus Task Force announced people who are at highest risk of being hospitalized or even dying from the coronavirus need to right now start implementing what they call social distancing practices. As the name suggests, social distancing means keeping your distance from people. So this means especially avoiding crowds, avoiding flights, and especially avoid taking a cruise. And they extended this warning to people who are young and healthy, who are at low risk of having complications from coronavirus, but who have close contact with high-risk people. Now, this includes people where they live in multi-generational homes. So let's say you live with a parent or grandparent who might be at high risk, or maybe you work with somebody who is at high risk. Remember, we've talked about what it means to be high risk. 80% of people who get this virus are going to have very mild symptoms or no symptoms at all. But that other 20%, these are people who have underlying health issues like heart disease or lung disease, especially people who are elderly.
Lorie, when we were first talking about it, you indicated influenza was much more of a killer than this coronavirus. Now I understand that the numbers, the percentage of deaths is something like 3.4%, but that's out of 100,000 cases. Well, what do you think the death rate is going to be on this thing? Do you know?
That's actually a great question. The World Health Organization says overall the death rate is a little bit more than 3%, but they say that that is likely to decrease as more people are tested. Because, Pat, when we see a lot of people tested, then we see a lot of these very mild cases. Remember, the death rate is a very simple math problem. You take all the people who have the virus, and then the death rate is the percentage of that number who die from it. So, for example, here in the United States, not that many people have been tested yet, and the death rate is 5% because doctors are recommending people right now who are very high risk to be tested. But as more people are tested, millions of these tests are being sent out as we speak, and still millions more are going to be available in the weeks ahead. So we're going to see a lot more people being tested who have only mild symptoms or no symptoms at all, and that's going to drive down the death rate. Right now, the death rate for the flu is a little bit less than 1%. And we see in South Korea, where there's massive testing right now, the death rate from the coronavirus is less than 1%, almost in line with the flu.
Lorie, I understood also that Russia hasn't been reporting anything, but I was told by somebody who's in the know about Russia that they really have a very high incidence of this disease. Do you know anything about that?
Well, what's interesting is there's a lot of sort of speculation about the facts coming out of countries that are not our allies. So we look at China, and people are sort of skeptical about the information that they present, and now also Iran and Russia. But we do want to look at some of our allies like South Korea and Italy and look and see what's happening there as far as what kind of facts we can rely on.
Lorie, if somebody has this, what do they experience? Is it something in the lungs? Is it a high fever? Is it a terrible headache? I mean, what do they experience?
This is a respiratory disease, and the three main symptoms are cough, difficulty breathing, or shortness of breath, and a high fever.
Well, if somebody has it, I mean, are they then hospitalized? I mean, they're incapacitated with it, or they're walking wounded? I mean, what goes on?
Well, it's very interesting because 80% of the people who have it have very mild symptoms, and so many people don't have symptoms at all. We know this to be a fact, Pat, because we see some of these cruise ships where every single person on board was tested for the coronavirus, and so many of the people who test positive never have any symptoms. So again, we worry about the people who have maybe a pre-existing health condition, who are elderly, and these people need to contact their doctor if they're showing any symptoms, and their doctor will determine whether they need to be tested for the coronavirus, and if they test positive, if their symptoms are mild, they may be asked to quarantine at home for a couple of weeks, and of course, if their symptoms are more severe, they may require hospitalization.
All right, when we were on before, we offered something called Bill the Butter Gut. We've had over 200,000 requests for for this booklet.
Great.
You said, and I want to say it again, that the immune system, about 80% of it is located in the gut. So if you have a strong immune system, are you pretty much going to have a mild case of coronavirus or no case at all?
Well, it's so important, Pat, for all of us to do our part and try to stay healthy. We know that hospitals, for example, have about 50,000 ICU beds just ready and waiting for coronavirus patients. And they say that they're going to expand that to another 50,000. And they have about 60,000 ventilators. So that's great. But we can all do our part to make the hospitals available for people with coronavirus by not getting sick ourselves, because we know right now hospitals are overwhelmed with people who have the flu. This is an extremely severe flu situation, a very serious flu season right now. So yes, we can all do our part by not getting sick and overwhelming our doctors' offices and our hospitals with other issues. And again, getting back to interacting with people who may be high risk, we should all be practicing social distancing when we interact with people who are high risk, because we might not know that we have the coronavirus. So we need to be careful about kissing our parents and our elderly grandparents. As much as we hate to avoid doing that, it's only temporary, but really keeping our hands clean. And if you're living in a home that's multi-generational and somebody has the coronavirus, we need to keep our distance and keep the sick people away from the well people.
Thank you, Lorie. Ladies and gentlemen, we've got something that Lorie did. This is called a news alert. Coronavirus, what you need to know. It's a fact sheet. We'll give you that. It's got a number of things. On the back, the 91st Psalm, which is encouraging. So we'll give you this. And this has been so important, as Lorie said. 80% of your immune system is located in the gut. And so to keep the gut flora, you want those little critters in there doing good things for you. It means you need to take a probiotic, and you need to have something to feed the little critters, which is called prebiotics. Build a better gut. This is free. No finances. We'll give it to you free as our gift to you, because we want you to be healthy. 1-800-700-7000. Say, send me a copy of Build a Better Gut, or else get the fact sheet. And I don't know, Terry, I've never seen a disease that's got everybody so freaked out. I mean, what is it?
Well, I think the potential of it is maybe what's frightening. The fact that people can be infected and carriers and not evidence it in any way. So I think it's all a matter of trying to contain it before it becomes something bigger than life. Right now, I think people are doing a good job of that.
It looks that way. I mean, my goodness, everybody's fist bumping and they're not kissing in churches and they're elbowing each other. I mean, good. But the big thing is, wash your hands with soap and water, and then wash them again, and then wash them again, and wash them again. I think more than anything, of all the hygienic measures that doctors and people can use, it is hand washing is number